Start right now?
Yeah, we are live and I'm
Dr. Rajat.
to everybody. On behalf of Voice of Healthcare and Zydus, allow me to extend a very warm welcome to all the speakers on this Sunday afternoon today. As all of us know, the month of October is known as Bone and Joint Health Awareness Month. So, in the same context, Voice of Healthcare, in collaboration with Zydus, has taken this initiative to recognize and incentive, and by organizing a series of virtual awareness discussions. Today, 16th of October, we all know is marked as World Spine Day. On the same note, we have a very esteemed set of experts with us who shall enlighten us with all the common signs and symptoms, common do's and don'ts, and some lifestyle interventions for spinal health. The topic for today's discussion is We've Got Your Back, emphasizing spinal health and well-being. Further ado, I'll now like to introduce the speakers for this discussion. We have Dr. Rajat Mahajan with us. He's consultant spine surgery at Indian Spinal Injury Center, New Delhi. Welcome, Dr. Mahajan.
Thank you.
We have Dr. Amit Agarwal with us. He's senior consultant orthopedic surgery in Indraprastha Apollo Hospitals, Delhi. Welcome, Dr. Agarwal.
Thank you.
We have Dr. Gaurav Rathore with us. He's director at Department of Orthopaedics and Joint Replacement at Jaypee Hospital, Noida. Welcome, Dr. Rathore.
Good afternoon, everybody.
Good afternoon. We have Dr. Ankur Nanda with us. He's senior consultant spine surgeon and chief of spine services at Indian Spinal Injury Center. Welcome, Dr. Nanda.
Thanks, Khushbu. Happy to be here on this occasion of World Spine Day.
Thanks so much, Dr. Nanda. We have Dr. 𝗕𝗨𝗏 with us. Sir is senior director and unit head, orthopedic and joint replacement surgery at Max Super Speciality Hospital, Pakhtarganj, Delhi. Welcome, Dr. 𝗕𝗨𝗏.
Thank you very much, Khushbu, and thank you for inviting me here.
Thanks so much, sir, for being here. We have Dr. Sanjeev Mahajan with us, who's Director, Orthopaedics, Joint Replacement and Arthroscopic Surgery at Fortis Hospital, Ludhiana. Dr. Sanjeev would be joining us in the next couple of minutes. We have Dr. 𝗕𝗨𝗏 with us. Sir is Chief and Head Orthopedics at Artemis Hospital, Gurgaon. Welcome, Dr. Jha.
Thank you, Khushbu, for introduction.
I'd like to bring everybody's attention that Dr. Jha would also be moderating this discussion. So without any further time, let's begin this discussion. Over to you, Dr. Jha.
So welcome all. And this World Spine Day, we are talking about how we can preserve our spinal health and spinal health well-being. So to start with, first panelist, Dr. Rajat Mahajan, I would like to ask Dr. Rajat, what is the incidence of disability due to spinal disease in both urban as well as in rural population? Dr. Rajat.
Hello, sir. So spinal disability actually is a very broad. It encompasses a lot of spinal problems. It can include spinal back pain, it can include spinal trauma, it can include spinal diseases or any other malignancies also due to the spinal cord involvement. So, it is a very broad topic, spinal disability, but if we look into the literature, at any point of time, or if I say a point prevalence of spinal disability in the world is around 8%, but this number varies because this number is taken from the literature. So point prevalence of a spinal disability, or the problem due to the spinal issues can vary from 8 to 20% depending upon to the literature in which this number is quoted in the different studies. So it is a very broad thing. Now coming on to the urban versus rural, it also varies from different place to the place. For example, in India, if we look at our rural population, it might be very different from the rural population that we look in the USA. So but if I talk about India, then certainly the spinal disabilities, if I talk just about the back pain, then back pain is certainly more in the urban population as compared to the rural population. But in some of the spinal diseases might be more common in rural as compared to the urban, like spinal tuberculosis or spinal malignancies, which have more chances to get neglected in the rural population as compared to the urban population. But I've just talked about the back pain, then back pain is certainly more in the urban population as compared to the rural population. So it is a kind of a big box, and it can cover spinal disability. It takes into lot of things. But if I just talk about the back pain on this spinal day, then certainly the back pain is more common in urban population as compared to the rural. Sir, you are muted. Sir, you are muted.
I have seen this difference in urban as well as in rural population. So there is a incidence difference between different age group as well as male versus female. So Dr. Amit, can you highlight about whether there are any difference exists between the incidence in male as well as female population?
Yeah, definitely there is a. If you search the literature, they say that the incidence of low back pain is quite high in females compared to male. Probably this is because of there are so many factors. There is no consensus in the literature, but when you study the different papers, what they will say that the chances of osteoarthritis is more in female, and facet joints. We have facet joints that could be the cause of the back pain, and the disc generation in post-menopausal females is high compared to males. In younger population, if you compare, the males have more chances of having the disc degeneration, but then post-menopausal they have more chances. They are more prone for having osteoporosis compared to males, and they are more prone for UTI, dysmenorrhea. They have a menstrual cycles, frequent chances of emotional stress, emotional breakdown. All these things make them more prone for back pain. They have to face the pregnancy, and during the pregnancy perimenopausal period, that period is very stressful for the back, considering there is a huge almost 10 kg weight gain around the abdominal, which leads to the stress on the back. And there are some hormonal changes like relaxin hormone and those things, which leads to the relaxation of the sacroiliac joints and the other ligaments of the spine. And other factors like obesity also, the literature says that they are more prone for obesity in the elderly age group. So all these points, almost 8-10 points are there. So all these points make them more prone for back pain compared to their male counterpart.
Okay. So let me induct our next panelist, Dr. Gaurav Rathore. So, Dr. Gaurav Rathore, can you see like incidence difference in different age group? Like in your practice, which group you like see the most spinal related issues?
So there was a time when it used to be more common in middle-aged people, elderly people, but these days with poor posture, people becoming more sedentary, including younger children, back pain has become a ubiquitous phenomenon. I see back pain in virtually all age groups now. I think the preponderance would be in the middle aged and the elderly, but now we are seeing a lot of younger and younger people coming to us with back pain, discogenic pain, sciaticas, and I think it's probably related to poor posture, sedentary lifestyle, people spending a lot of time in sitting in their chairs, their core strength is becoming weak. So I think in the coming years, there will not be any age preponderance in terms of back pain. There will be different types of back pain we'll find, but I think it's going to be affecting virtually everyone, which is a little alarming thing.
Okay. So, in our residency, we used to learn about the red flag signs that extreme of age, like especially backache in children or elderly, considered as red flag signs. So, Dr. Rathore just mentioned that no age group is immune
Spared.
for this kind of uh, spinal related elements is seen in all age group. So, Dr. Sanjeev Mahajan, can you highlight what are the spinal problems we face in the pediatric age group? Dr. Mahajan, are you there?
I think he's not there.
Okay, okay. So I think in children, as Dr. Rathore already mentioned, it's more of a lifestyle issues. How we maintain our postures, especially we can see the children's school going age groups. It's a posture which is the most common etiological factor. Other than that, I think they should be investigated properly if it's other than lifestyle issues. So let me induct our next panelist, Dr. Tomar. Dr. Tomar, can you highlight what are the risk factors which are associated with the low back pain?
I think Dr. Tomar, you are muted. Can you unmute your screen, please?
Dr. Tomar, we are not able to listen to you.
Okay, now I have unmuted myself.
Microphone, like you can keep microphone closer to you.
Microphone is not there.
Yeah,
Yeah, but you are
better.
audible now. Yes.
Yeah, yes, sir.
Yeah, now am I able now? Also.
So there seems to be some
Hello.
connectivity issues with Dr. Tomar.
Yeah, I think there is some net.
There is some lag, sir. Can you check your connectivity? And
You can
meanwhile,
pause your camera and then continue with the
with the
voice.
voice one, sir.
Yes. You switch off your camera, sir.
Now?
Yes, sir. Audible. You are audible. You can continue, sir.
Yes, sir.
This back pain is there is no age bar. It is common in all age groups now. Initially, we used to have back pain only in the or the elderly. The younger children are facing this problem. We used to think that if children are having back pain, it is because of some kind of infection or some kind of tumor, but it is no longer the first diagnosis, first differential diagnosis. No, the issues are the same, whether it's young population, the middle-aged, or the elderly population. The main risk factors are the lack of, as you know, that is because of lifestyle. It is basically the lifestyle disease. There are lack of exercises, muscle weakness. There are poor postures, deficiency of vitamin D, calcium, and other minerals, and there is repetitive exercises. Like few people are doing wrong exercises, and not only that they are not doing exercises, they are doing wrong kind of exercises. Recently, one patient came to me. That patient was perfectly all right, but then started having painful last 2 months. The only thing he was doing, that he appointed at the age of 58. He appointed some yoga expert and started doing the Surya Namaskar several times, and he kept on increasing this, say 20 times, 30 times, and started having back pain. And when he stopped doing these exercises, only then he could get rid of this pain. So it is not doing exercises, doing the wrong exercises also. So these are the main risk factors which we all know. And the most common thing is like repetitive exertion. Exertion means like some exercises are to the physiological limits, and the other exercises are not to the beyond the physiological limits. So that is not exercise that becomes a strain to the any joint, the spine, the muscles, and that may lead to the degeneration and the pain and the disc problems. Like somebody is traveling per day, say 50, driving 100 kilometers a day. So it is not physiological, it is beyond the limits. And every day is doing the same, the person is doing the same. So it is ultimately going to damage the spine and the other joints also. So these are all the kind of risk factors which are related to, and one more is like the BMI, high BMI. If weight is more, that is going to cause more exertion of the spine. Exertion may lead to back pain. Back pain.
Okay.
Yeah.
Okay. So, any other panelist wants to add, because it's a very important point we are discussing here, the risk factor which is associated with the low backache. So, any other panelists want to add something there?
I would
Dr.
like
Gaurav?
to add one. Yeah.
Yeah, please.
Yeah, in my own practice, what I noticed, the biggest risk factor to back pain is sitting. You see, 100 years ago, 2 generations ago, there was no furniture. People used to squat or sit on the floor. They were constantly sitting, getting up. Their core muscles, their leg, glutei were a lot more powerful compared to the generation now. Most people, when they sit in a chair, they slouch. Their lumbar concavity is gone. So I think those are the big reasons why, we are getting back pain in younger and younger people. We get degeneration. And I think it's all related to basically the weakness of the core, the, degradation of the posture these days. So, and most of the time, my consultation is basically telling the people that this is what you need to address. You need to improve the posture. You need to be a lot straighter. Your spine is getting really compacted. You need to really be stretched out. And while I take the fact from Dr. Tomar that, people should be cautious about doing exercises, but I think the real solution to back pain is exercise. Yes, people have to be a lot more aware and mindful how they increase their exercises. If you start doing 40 Surya Namaskars without conditioning your body, you are bound to get discomfort. So I tell people, play it, with a little bit of common sense, but increase your core strength if you want to get rid of pain. There is no medical solution to back pain.
Okay. So, any other panelists want to add something there
I
in this
wanted
point?
to add one point that when we were kids, we used to play outside. We used to go and play out all sort of physical activities, running, jumping. But nowadays, the kids are glued to their screen. They are playing. They are more interested in indoor that screen games like mobile, and they're spending more time with the screen. So their physical activity is almost negligible, especially post COVID when you see. So this is also contributing. Another factor is the school bags. Previously our time, the school bags will not used to be so big. Nowadays, you will see the kids are lean and thin, but they're carrying a big bag on their back. So that is one thing in younger population in the kids age group. When it comes to the office goers, as Dr. Rathore said, that yes, definitely ergonomics plays an important role. They are sitting for hours altogether without knowing about their posture, without knowing about the ergonomics. And second most important thing is traveling. When the patient comes to my clinic for the back pain evaluation, I always ask this question: how much time do you travel? And most of them will say, I'll go from Ghaziabad to Gurgaon. So 2-3 hours daily they are spending driving. So
Yes.
that itself is a culprit. You need not do any investigation. This question itself is a self-explanatory that they have the back pain. They are bound to have this back pain. So traveling, traffic, all these things, and prolonged sitting, bad ergonomics, BMI, all these things are important factors. And then vitamin D, when you check them, it's almost negligible. When you ask them what is the lifestyle, they get up late in the morning, or they, even if they are getting up early in the morning, they have to rush to their office. They don't get enough sunlight. The diet is poor. They come back. They don't do any physical activities. So all these things are, they are somehow trapped in that lifestyle. All these things are contributing. So only thing, you need not give any medicines. You just guide them, you just them teach. These could be the one of the factors, and you try to help them with that.
Okay. So I would like to induct the next panelist, Dr. Ankur Nanda, and I want to ask about two things. First, uh, what leads to the higher incidence of spinal disease in urban population? First, Dr. Ankur.
Okay. So should I go ahead? Yeah. So I think the reasons are more or less known to us, obvious, and I think a lot of panelists has touched on that point. The urban population is something which is running the race, if I may say. We are very busy. We are very aware of our surroundings, and probably the urban population has a lot to do, a lot to struggle to make a livelihood. As I think Dr. Amit was pointing out, staying in a big metro city involves a lot of traveling. It involves a lot of job pressures. It involves, carrying your lunch with you, and that lunch is something which is prepared early in the hours, by your homemaker or your help, and probably you end up compromising on your meal as well while you are working, and then getting back in the rush hour late in the evenings. You are quite tired by that time, and lack of quality of life in terms of involving any sport or going for a regular walk or exercises is something which not all of us are able to do. So the urban population goes ahead with lack of time, not getting proper nutrition, even though they have the means to eat well, but they don't have the time. And at the
Dr.
same
Ankur,
time, I
sorry,
think,
so sorry to interrupt. I think there is some voice issues with the with your connections. Yeah.
can you hear me now?
Um, maybe we. I think you're traveling, so maybe the connectivity issues. Okay.
Yeah,
Okay.
but
Continue.
can you
Please
hear me
continue.
now? Yeah. So what I was saying is, it's the challenges of living in a big city, a lot of traveling, a lot of nutritional issues, and
Mm.
lack of time is something which leads to the urban population getting more back pain. At the same time, with the all the junk food which is available in the myriad
Uh,
of restaurants and eateries, uh, it becomes the nutrition becomes low. So yeah, I think the urban population is definitely having more back pain issues than the rural population.
so I think some still there is some problem with the connectivity.
So I've
So
parked by the side of the road, if that helps.
so I want to ask like the other part which I wanted. Like patients with the low backache keeps ignoring like things for a longer period also, because most of backaches, low backache and other things resolves spontaneously with rest and other things also. So in that hope, many patients ignore their backaches. So I want to ask, once the patient is dragging this complaint for a very longer period, so what complications can happen? Like there is a myth that backache can lead to paraplegia and other things, the weakness. That's a very common myth. So is it true, or what other complications we can see if we keeps ignoring this backache for a longer period? I want in slight detail, Dr. Ankur, about this.
So I think it's a very relevant question. If I may, take it step by step. So when the patients, so 80% of us will get back pain once in a lifetime. Majority of these back pains are usually muscular, mechanical, postural in nature, and if the patient does a short period of rest and
So I think there is some voice issue. Other panelists feel the same.
exercises, then things get better. But oh, can you hear me?
Yeah. Better, but much better voice.
Yeah. So, so usually the short short-term back pains are more postural or mechanical related. Now, moving on to the pains which have remained for a long time. What can be the reasons for that? I think we can divide it into age-wise or gender-wise. So if you look at the ladies, and if you look at somewhere who are in the postmenopausal period, usually osteoporosis is one of the most common causes for long-term backaches. And as we know, the Indian lady is very busy with her family in taking care of her family. She hardly cares about herself, hardly gets the time to take care of herself. And then we have all seen in our clinics that this long-term back pain due to osteoporosis turns into a fragility fracture one day, and they end up in the emergency, or they come with a severe pain which has come. So that is something which is very important. I would like to highlight on 20th October, just 2-3 days down the line, we have World Osteoporosis Day as well. And we must understand these chronic backaches in middle-aged ladies or even men can be because of osteoporosis, and it can be very, very devastating in terms of if you get an osteoporotic fracture. And so we need to be aware of this fact. And majority of the times what we have seen is usually people will tend to eat calcium and vitamin D. They will get their blood test done for serum calcium, and when you tell them that I think your bones are weak, they would counter you by saying, sir, mera blood calcium level to bilkul normal aa raha hai. So I think we need to spread awareness that calcium and vitamin D is more for prevention of osteoporosis, and if you are osteoporotic, then you need things which are more than that. At the same time, there can be other causes which are leading to long-term back pains. Something like if you have developed a spinal deformity because of degenerative process, something like a degenerative scoliosis, if it's developing. At the same time, if there is a listhesis which has developed, or in the midterm pain, it can be infections as well. So we need to basically understand the difference between a postural back pain and a back pain which is more serious, and the people need to get aware about what are the warning signs and signals when you should not take your back pain lightly and get to a healthcare professional immediately. So any pain which is associated with any back pain which is associated with any tingling numbness in the legs or in the arms, or any pain which is shooting down the leg, or any problem in having a balance issue or things like that. So any red flags which are there, then the patient needs to immediately go to the nearest hospital or the doctor and get himself checked. I that is what I would think is how the long-term back pain would harm the patient.
Thank you for this insight. So, the same question I would like to ask Dr. Gaurav about the same thing. What is the experience like delaying the treatment of these spinal issues can lead to long-term deformities and other things?
Yeah, I
Dr.
mean, it's
Gaurav.
not an uncommon situation that we find elderly people coming, not even just elderly, sometimes people in their 60s coming to us with severe degeneration of their backs, and as a result, they develop deformities. Some of these patients I would refer to my colleagues who would do spinal surgeries. But my first line of treatment is always, I tell patients, this is a problem which is associated from your lifestyle. You have sat in the wrong way, you've not worked on your spinal muscles throughout your life. Unless you're going to work on that, this does not improve. So that is always my first line of treatment. But yes, chronic back pains, then, usually acute back pains, I rarely investigate. I don't do any even x-rays for them. But chronic back pains where there may be some red flags, elderly patients, there I would investigate them a little more, and occasionally I would even do MRI scans, because there have been instances where we've picked up metastases, etc. And I would look for red flags like weight loss, any constitutional symptoms. And patients who get night pain, they tend to worry me a little bit as well, because sometimes a lot of pathological conditions can be associated with that.
Thank you. So, before going to the next round, there's a question which has been asked about the this backache and other spinal problems in pediatric population. So, what are other signs which we see in the pediatric age group? One I can tell you in my experience is a hamstring spasm. Patient presenting to us with a thigh spasm and something, and when we investigated, then the cause was in spine, lysis and other thing. So, Dr. Rajat, can you give us insight about this any signs to look after in pediatric age group?
So the back pain incidence in children is, I will say, 0%. So if there is any back pain in a child, it should be investigated thoroughly. Most of the children, they can't say, they will not complain unless until there is a cause. So if the child complains of a back pain, it has to be investigated thoroughly. As you said, the hamstring stretching, hamstring shortening, it can be seen in children if they have got, an ischemic listhesis or a dysplastic listhesis, in which one vertebra slips over to the another. So the symptoms in this child will be, this child will have a protruded buttocks a bit, and they will not be able to bend forwards, and will not be able to touch their toes because of the hamstring shortness. And these children will complain of constant back pain. So these children must be investigated by an X-ray. X-ray will show obviously a listhesis in which one vertebra slips over to the another, and most of these kids will require surgery. Sometimes uh, the kids with the back pain can have also associated conditions like scoliosis, or some congenital anomalies can be there, like kyphosis will be there. So these conditions can be diagnosed by clinical examination alone. So you need to sit behind the child and try and tell the child to bend forwards and try to touch his toes, and then you sit from the back and try to examine his back. So if you feel that there is any hump is there, then that will suggest that there is probably some scoliosis or kyphosis there, which can be confirmed on X-rays. Other than these deformities, sometimes these children can present with tuberculosis. In these conditions, these kids will complain of constant back pain, which will be going on probably from 1 month to 2 months, and these children will be complaining of night pain also. The pain will become worse when they will do some activities, or for example while traveling in a car, if they experience a jerk, then the pain will become aggravated. So this tuberculosis of the spine can be confirmed by getting an MRI scan in children, because X-ray usually detects these spinal tuberculosis late, when already around 30 to 40% of the vertebra is already destroyed. So infection has to be ruled out if the kids are complaining of constant pain in the back. If there will be infection, there will be a point tenderness in the back. If you just thump the back, then there will be just a tenderness over one single point will be there, which will suggest that probably yes, this point is somewhere abnormal. If there's a point tenderness, then it should be investigated thoroughly, because that means that something is abnormal in this particular region only. If there is if the thump and the child is saying that there is a diffuse back pain, then probably something it is not of a much of a concern, and the chances are high that you will not find anything if you investigate. So yes, infection and spinal deformities have to be looked out in children, and if the child complains of back pain, then examine them thoroughly, because the child will not be malingering.
Okay. Many times this backache gives with other, especially if pain is in other joints, hip joint, knee joint, other, um, then it can give a confusing picture. So we have two very prominent arthroplasty surgeon with us, Dr. Tomar and Dr. Amit. So I would like to ask them about sometimes we are not able to decide which is the primary cause. When we examine the hip, and there is committant backache also. So can you give some insight, Dr. Amit, about
Yeah,
this
I have I have seen
concomitant problem?
yeah, post
What is
COVID.
the
I have
cause? Like main spines to be treated, or the hip joint to be treated?
yeah, I have seen patients with avascular necrosis
Dr.
being
Amit.
treated. Yeah, can you hear me? Am I audible?
Yeah, yeah, yeah.
Yeah, so I have seen patients with avascular necrosis being treated for low back pain. So it's our duty that we need to, all spinal surgeons should examine the hip and knee, and all orthoplasty surgeons should examine the spine, so vice versa. Because sometimes there may be coexisting issues, or maybe sometime hip pain presenting like avascular necrosis, which is quite common after the COVID, and they are presenting with the back pain, because difficult to initial stages, difficult to examine. When you do the X-ray, X-ray will be almost normal. So first we have to take the history. We need to ask the patient where exactly is the pain, and whether it is coming from the spine, or it is around the hip, or its knee. And sometimes knee pain also coming from the hip, radicular pain. So avascular necrosis of the hip it may present with the back pain, with the knee pain also. So we have to be very careful about all these areas. And first thing is we have to listen to the patient. That is very important. We should not judge from ourselves. He should, and most of the incidents I have seen, that patient himself will tell that I have this pain more than that pain. So in those cases, suppose you have a back issues and hip issues, then you need to take a call whether you want to operate the spine first or the hip first. So you can, depending on the pathology, you can take a call. And hello.
Okay. Okay.
Yeah.
Dr. Tomer, your insights
Yeah.
about the.
It nicely pointed out that hip pain is confused with the spine pain, and the spine with the hip pain, and sometimes hip condition, there is radiating pain in the knee. So we have to be careful about that. But one thing that is very clear, that we have a lot of patients of osteoarthritis knee. So osteoarthritis knee, almost the more than 80% population after the age of 60 years is suffering from this disease. And because of the osteoarthritis, there is a definitive change in the gait pattern of the patient, which is ultimately causing a strain over the back. And there is a collateral damage in the spine. Collateral damage in the spine, and that will ultimately lead to the degenerative spondylosis, and the spine conditions degeneration may lead to the protrusion of the disc and causing fascial joints. Question comes how to differentiate between the knee pain and the spine pain, whether we are going to operate on the knee, we do the replacement, and the pain may persist in the legs because radiating pain may persist in the legs. So should we go for the spine first, or should we go for the knee first? That is a very pertinent question. Very pertinent question. So in most of the cases, my take on this is that we do a lot of cases of this, and we have published papers on this also. Like, if we have to take any patient for the replacement surgery, we have to examine the back carefully. MRI scan also. MRI scan, of course, will show the gross degenerative changes. May say some radiating root pain also. But if there is any neurological deficit, any sensory or motor deficit is there, then we have to address the spine condition first before taking the patient for knee replacement surgery. But if the patient is not having any sensory or motor deficit, is having only radiating pains, so then in most of the cases, the condition after the total knee replacement, when the gait becomes normal, will subside, and patient will not need any intervention, and the pain will subside. But even then, we have to tell the patient, explain to the patient that patient will, 90% cases, patient will improve after the knee replacement surgery, but patient may need some kind of intervention for the spine also. But it is our priority to tell the patient that first thing, this has to be done. But if there is some definitive neurological condition, like if there is lumbar canal stenosis, the spinal diameters are much less, and then it is not going to improve after total replacement surgery. In those cases, when there is definitive lumbar canal stenosis, they have definitive neurogenic claudications, and confirmed on MRI scan and on the NCV, and the most motor and sensory deficit is there. Any motor deficit, any motor weakness, any sensory deficit, then our priority will be to address the spine first and taking the patient for knee replacement surgery after addressing the spine problem.
Thank you. Thank you for this useful information, sir. So we have completed the round one, where we have discussed the incidents, the causes. Now we are moving to the second round, and I would like to start with asking Dr. Rajat, what are the lifestyle modification that we can do to prevent our back problems like deformities or low back?
So I think this topic has already been covered by most of the panelists. The most important thing for
You can summarize it.
everyone is to do exercises. So the strengthening exercises is one of the most important thing that everyone of should do, even including the doctors. I think we preach a lot, but I think we are the biggest people. We are the biggest group of people who don't do exercise. So all of us must exercise. All of us must do strengthening exercises. Stretching exercises like yoga also help in preventing the back pain. So this is the message which I would like to share with all the people, or all the kids over there, that they must exercise must spend at least 45 minutes to an hour daily doing exercises. The kids, they can, for the kids, the play, they can simply play outdoors. That is their biggest exercise. They need not do like strengthening exercises like the adults need to do. They just need to go outdoors and play rather than sitting onto their computers and playing video games. They just need to go outdoors. The problem in this era is the kids are hooked onto their computers or their PCs or their televisions and are not going outdoors. For adults, like for us, like who are in their 40s, 30s, or even who are in 50s, these are the people who are most prone to get now the conditions like diabetes, hypertension, or all these problems, lifestyle related problems. For all of us, we should walk at least 45 minutes a day. This walk 45 minutes a day is mostly sufficient for strengthening our muscles. We must strengthen our core muscles, which can help to prevent these back pains. Another important thing is we must maintain our weight. Even losing a few pounds of weight can help our back muscles. For example, if you are if you are gaining weight and your belly is constantly protruding, then your center of gravity is constantly pushing forwards, then your back muscles have to do more work to to keep you upright. So if you are getting obese, then certainly your back muscles have to do more work and you have more chances to get back pain. Third is if you smoke, then you must stop smoking. Smokers have a higher chances of back pain because the smoking, it decreases the blood supply to our intervertebral disc. So the smokers have a higher chances of getting dehydrated disc or degenerated disc at an early age. So smoking is one risk factor which I always ask for my patients. Even if I'm going to do their surgery, I ask them to stop smoking for at least 3 months before, because even after doing the surgery, the chances of fusion goes less if they are a chronic smoker. Then as everybody has told, the posture is an important. You must sit in a proper posture. If you are you can't leave your jobs. So if you have to travel for 2 hours, you have to travel. In urban setting, I can't tell them that you can't go to your job. If they have to go, they have to go. But the most important thing is you must do exercise. You must sit in a proper posture. If you sit, try to sit in front of a desktop instead of a laptop. The monitor should be at an eye level, and the keyboard should be at a lower level. If you type at at a high, if you keep your keyboard high, then your trapezius are going to fatigue very soon. So keep your keyboards at a lower level and keep the monitor at an eye level. With laptops, it is usually difficult, but if you can switch over to a desktop, then that can help. Take frequent breaks in between. There need not to sit for a continuous for continuous hours. I will say take a break for every 30-35 minutes. Just go around, move around, then sit back. So these things, they help. So I think, yes,
Yeah,
that is the
you have covered most of the things. So it's a lifestyle issue, and that can be dealt with the lifestyle modification. And one very important point you mentioned here is the ergonomics. What we do, we adjust according to our workplace, but it should be otherwise. Your workplace should adjust according to your needs. That's the proper ergonomics. Okay, so
another
coming
point.
to, yeah, please.
Another point which I wanted to, I see a lot, especially in the post-COVID areas, a lot of patients now, at least 15 to 20% of my OPDs, are the patients who complain of constant neck pain, headaches. So most of these patients, if you ask them, in detail in their history, most of them having some stress, or most of them have got some psychosomatic complaints. There will be depression, they will be sad, or, the lack of sleep will be there. So most
Yes.
of these neck pains and headaches are, you need to ask the history in detail. Otherwise, it will lead to unnecessary investigations.
Under
Most of these
underlying depression or minor
yeah,
depression or something. And one point
big
I would like to add here, what I see now my practice also, is the eyesight. Some people having eyesight also develop this trapezius pain and other things, so they need proper eye testing also. So that brings
I
me
think
to
I'll
the,
just add one more thing here. You see, a
yeah,
lot
please.
of these trapezius pain, neck pains, and head pains are related to something called forward head posture. You see, a lot of
Yes,
us spend our time spending hours in front of a laptop, in front of phones. And, instead of keeping our head centered on the spine, we tend to keep our head a lot forward. Our shoulders have tended to roll forward, and that has become like the modern posture of human beings. I think that itself plays a huge role in causing degeneration of your C5, C6, C6, C7. And instead of calling it cervical spondylosis in my practice, I call it forward head posture syndrome. And I tell people,
mobile syndrome. You can
you
also
can call
tell
it tech snack, mobile syndrome. So I think that really contributes. People think that 2 hours of screen time is not a lot, and I think it's quite a lot.
True, very true. So prevention, and now coming to treatment. So the most common modality we prescribe is the painkillers. So painkillers are temporary. So what are other modalities which are available and which can benefit our patients? Dr. Amit, can you give some insight about?
Yeah, apart from because most of the acute pain, we end up giving painkillers and rest for few days only. Some physiotherapy, local heat or cold, some gel, capsaicin gel has been advised, and but when it comes to the chronic pain, it becomes difficult. Actually, you can't give painkiller forever. In those cases, you can give gabapentinoids or anticonvulsant drugs like gabapentin and pregabalin. Those uh, uh, drugs has been seen to improve the symptoms, specifically if they have a radicular pain. Definitely they will help. And apart from those things, if the patient is depending on the specific problem, like if they are osteoporotic, we have to treat the osteoporosis properly. I have seen patients uh, osteoporosis, they know osteoporosis, but they are not taking the prescribed medications like some injectables, teriparatide, or whatever is required actually, depending on the severe osteoporosis minus 4.5, but they are just taking calcium, and they, when you inquire, they will say that we are taking proper treatment. So that need to be correct actually. They need to be teach about the importance of osteoporosis and what it can cause. It can cause chronic back pain. Apart from that, there are certain interventions which can be done depending on, again, on what is the etiology, like caudal epidural or epidural steroids or radiofrequency ablation of the nerves. There are so many other modalities which can be bring in if required. Right.
Yeah. So very rightly said. Uh, uh, Yoga is one of the modality I feel de-stressing meditations and yoga certainly helps in this chronic backaches where there is no anatomical like very anomaly or something. So that
And yoga
helps.
specifically, when we advise yoga in patients with back pain, we always say that always do the guided or supervised
Right.
yoga.
Supervised.
Begin.
Yeah.
If you have a disc bulge and start doing the Surya Namaskar, definitely you will have aggravation of the symptoms.
Certainly,
So
certainly. There are
prevention
different
whatever you
levels of different levels of yoga also. So
so that is
the extreme one being
yoga has to be emphasized upon.
supervised. Supervised.
Yeah. Yes.
Okay.
When
So
when I prescribe patients, sorry, I'm interjecting.
yeah,
When I
yeah, yeah. Please,
prescribe patients
Dr. Gaurav,
yoga,
please.
so I tell patients, you see, yoga is very important that you have to do it very mindfully. I tell them, you don't have to copy a pose, you don't have to create a pose. You should feel if you're doing a back bend, which I tell patients with acute back pain to start with, just feel which level you can go comfortably in. It doesn't always have to be supervised. I've seen a lot of yoga instructors actually mess up people because they try to create a certain shape in a patient's body. So I usually tell them, just feel what you can do comfortably. You should understand these are the certain muscles you are trying to contract. These are the certain muscles you are trying to relax. So I think, in my opinion, yoga is probably one of the best exercise modalities, probably even better than physiotherapy when it comes to relieving back pains.
Supervised and certainly rightly directed things helps the patients. So this comes to second point. Today I have seen one patient in my outreach OPD in Jammu, a patient having L4 L5 disc with foot drop. So I advise the surgical treatment. And now he started telling na paraplegia ho jata hai and the legs become weak and something. He already developed foot drop. So that leads to our next question. What are the myths which are related to the treatment modality of low backache or in general the spinal condition? Because people are very afraid of undergoing surgical interventions. As I mentioned right now, कि paraplegia हो जाएगा. That's a very, very common myth among the population. So, Dr. Gaurav Rathore, can you help us with this myth?
Yeah, and I totally agree with you. That's a very prevalent myth, and that's a very wrong myth. So I myself have stopped doing spinal surgeries. I spend all my spinal surgery to my spinal surgical colleagues. But when I refer them, when I refer one of my patients to them, the patients are really apprehensive. You say, Doctor Saab, spine surgery, काम नहीं करते. And I think it's our job to convince patients that this is not 30 years ago where most spinal surgeries would fail to relieve patients symptoms, or even patients getting paraplegia. These days I think complications like that are vanishingly small. So yes, these myths are prevalent, and I think it's our job as patient doctors to dispel those myths. So paraplegia and spinal surgeries not working, not being required. I think yes, we have to be conservative in offering spinal surgeries to patients. But I think when we offer it to patients, and certain patients get it for the right indications, they're very gratifying surgeries.
Yeah. So, rightly indicated, patients, selective patients, processes are like something which gives permanent relief to the problems. So, Dr. Ankur, can you give some insight about the same myths? What you hear in your practice,
Um, I think
Dr.
starting
Ankur?
from the myths. Yeah, so if we talk about myths, the most common myth is that if there is a back pain, if there is a leg pain, the best thing is to lie down in the bed for 2 months, 3 months. And we must understand that bed rest, which is beyond anything beyond 3 days, leads to rapid weakness of the muscles, wasting of the muscles, and it is actually counterproductive. So this is one of the most common myths which I have seen, where people talk about a lot of bed rest. At the same time, uh, people's myth is that if there is a disc problem or if there is a back pain, then you are stuck for your life and you will never get better. It's a problem which is going to stay on, and everything is going to change for you. So it's very important to spread awareness about this fact that back pain is something which we can fight. And this is mainly coming from a, again, going back to lifestyle and maintaining yourself. And you can get out of back pain episodes if you take it right. But unfortunately, there is a lack of knowledge about this, even among some healthcare professionals as well, our colleagues as well, who are not from the specialty. And they would tend to sort of put people on rest, which further complicates the issue. At the same time, there are certain myths like spine surgery is never successful. It's something which can most of the times lead to deterioration in the neurology. And we need to spread awareness about this. Spine surgery, when done for the right indication at the right time, has excellent results, as Gaurav has pointed out. But the key is right timing, right surgery with the right person. Yeah.
No, very, very, very rightly said. It has gratifying, like very, very satisfactory results in selective patients. So, first thing, patients should be referred to the specialist whenever intervention is required. It's not just we should give him bed rest as a definitive option. So, this backache is modern epidemics. We have medicines, we have surgeries. So, Dr. Tomar, can you elaborate some newer modalities which is available, like in this field?
Yeah, of course, the surgery is not the first line of treatment, as told by the other faculty members, and it is the last resort. And we must try everything before embarking upon the surgery. And whenever the pain is not subsiding, then proper investigation should be done, and we have to know the right cause of the pain, and it is not subsiding with the exercise, usual mode of treatment, physiotherapy, exercises, supplements, and all medicines. Then of course there are some you need to go for some interventional treatment. As already told, some interventional treatment are in the form of epidural medication, facial joint injections, which are percutaneous thing, radio frequency ablation, laser ablation of the disc, and the facet joint. So these give the good, excellent relief to the patient. Then comes the surgical part also. Whenever there is extruded disc in the foramina, and it is causing compression, and you know that it is not going to going to be treated by conservative treatment only. Of course, then microscopic surgeries can be done. The percutaneous endoscopic discectomies can be done. And of course, after the end of everything, like whenever there is severe degenerative changes, chronic low back pain, and there are multiple facet arthritis and multiple root compressions, of course, then decompression and posterior instrumentation or fusion is the choice. That can be done endoscopically also. So these are the mode of treatment, surgical mode of treatment for the back pains, specifically lower back pains. And of course, these are can be done in the cervical spine also. But the surgery should be done with the right indication, as already expressed by the other our faculty members, and then should be done by the right expert person. And whenever you don't have the right expertise to doing that surgery, so should be referred to the proper surgeon who is quite accomplished in doing those kind of surgeries.
Yes. But one thing I would like to just differ from here, that it's not the last resort. Actually, surgical treatment can be the first step also in a few selective patients. So,
Yeah.
uh, yeah,
Can be the first line of treatment when you I told you, like when there is extruded
absolute,
in the
absolute indications. Absolute indications.
yes, there are absolute indications for surgery. So no, naturally, you know that it is not going to be relieved by any conservative line of management. So it has to be operated. It has to be operated. So then that is the absolute indication for surgery. And whenever you know that there is some kind of stenosis that is so severe and that is leading to neurological deficit in the lower limbs, of course, that is the right indication for surgery. You can't keep on waiting and keep on doing the conservative line of treatment. So those are the absolute indications. There is definitive neurological compression, and you think that it's not going to be relieved by conservative means, so that is the indication for surgery.
So we also see in our practice like ozone therapy or laser therapy, very like fashionable nowadays. So Dr. Rajat, can you highlight about this? And also one more thing, spinal cord stimulator is something like as a new modality also available. Dr. Rajat.
Hi. So actually, ozone therapy has actually got no role right now in the current practice. So I don't recommend any of my patients ozone therapy. I don't think so. It is. I think it is just a nuisance and it doesn't add any value to the treatment. Yes, spinal cord stimulator has got some value in the chronic pains. So if, for example, if a patient has got a chronic pain, and that pain is not going with your usual conservative treatment, and sometimes you operate on those patients also, and those patients present with the failed back syndrome, in which you are not able to find out any cause of pain even after doing an MRI, and those patients have chronic debilitating, non-dermatomal pains, which you cannot, prescribe to a specific point, or you cannot, prescribe the specific cause to those pains. Then in those patients, spinal cord stimulator can be used. But the spinal cord stimulator, you have to also see. It is not, it is a magic. It is not going to do magic. Most of the pain as such is such a complex phenomena. If a patient has got pain, then you need to really evaluate what is the cause of that pain. Is it a specific organic cause of pain? If you can locate a specific cause to that pain. If there is no specific cause, then you need to do the psychological evaluations also of those patients. So sometimes pain is very complex phenomena. So spinal cord stimulator fits in those patients in which you are not able to point out a specific cause of pain, and those patients have got the pain which is not going with the usual conservative treatments. Then in those patients, spinal cord stimulator trial can be given, and it has been found to be successful. But before putting a spinal cord stimulator, it is not your, you can't decide on it. It has a committee is formed in which there will be a pain physician will be there, a psychologist is there, and the proper patient counseling is done before putting that implant. So spinal cord stimulator sometimes can have a really dramatic, useful in some patients, but it is a very complex thing, and other causes have to be ruled out before putting on a spinal cord stimulator. Regarding ozone, I don't think so. It has got any value.
So is any thing like morphine pump or something like in terminal patients?
Yeah, morphine. These are the patient controlled analgesia pumps are there. They are very effective, and we put them regularly. So these pumps are basically for the pain control management, and even the orthopedic surgeons or spine surgeons, everybody uses them, especially in the post-operative period. So if the patient is having, I give them to all my especially deformity patients. So because these kids have immediately on the first or second day they will be having a lot of pain, and you have difficulty in mobilizing these kids immediately. So you can call your pain physician is there, and I tell him, and I also show those kids before surgery to him. So immediately after the surgery in the ICU, they put them on patient controlled analgesia pumps are there, in which the patient has a button and he will press onto the button whenever he feels the pain is there. So on in those pumps the morphine is there, but the dose with each pump is so low that it cannot even if the kid is going to press them 20 times in an hour, it will not cause any overdose of the morphine. So these patient controlled analgesia pumps are there, which are very strictly regulated and are absolutely safe. And the kids, on the first day of the surgery can start and roam around. Even if I have put 30 screws in the spine, on the first day itself, they will be up and about. So patient controlled analgesia pumps, morphine pumps are very good, and I give them to most of my deformity patients.
Okay. So this brings to the last part of our second round. And before that, I would like to ask Dr. Ankur also about his personal experience about the facetal blocks and other modality which is very commonly practiced in Delhi NCR. Like we have seen in pain clinics, the facetal blocks. So sometimes patient is confused. They take it as alternative for the surgery, disectomies and other things. So first, this point I would like to ask him, Dr. Ankur.
So, thanks, Dr. Jha, for asking this question. So, I think these pain interventions are very, very effective. There are different types of blocks: the facet blocks, nerve root blocks, SI joint blocks, and these all blocks are something which help us in taking care of the pain. It depends where the patient is pointing his finger for the pain. So, let's say if the patient has a pain which is radiating down his leg and is matching a dermatomal pattern, let's say an L4 and L5 nerve, then this patient is likely to benefit from a nerve root block, and a facet block is not going to help him there. But let's say if a patient has a pain which is little to the paraspinal, which is more on extension or rotating to one side, gives only pain on that side, then that is something which we know is coming from the facet, and a facet block will really help him. At the same time, if the pain is more localized to the SI joint, if your figure of 4 test or the SI stress tests are positive, then an SI joint block can help. Now we know that these blocks are something which are maybe limited by how much time will the relief come for. And if you have given a facet block to a patient and the patient gets good relief, but he gets the pain again in a month's time or 2 months time, then you can consider doing a radio frequency ablation for that facet, because that will then give him a longer term pain relief. But at the same time, it's important to understand that where there is no cross instability of the spine. So let's say if a patient has a lytic listhesis which is very unstable, or a degenerative listhesis which is moving a lot, and there's an obvious instability, then these patients, even if you give a block, may have a temporary relief, but they are definitely going to get their pain immediately back, and these patients will not improve unless and until you get in and do a proper surgical stabilization and fusion. So we need to differentiate between these type of back pains. For patients, back pain is same, but we need to get into the etiology of it. We need to establish if there is spinal instability, and that will help us in choosing which is a better patient for fusion and which is a better patient for facet blocks and root blocks. In scenarios of degenerative scoliosis, adult deformity, usually facet blocks, SI joint blocks are something which we always like to do before we plan them up for surgery, because in many cases these blocks will really give a huge lot of relief and they may escape surgery. Yeah.
Thank you for answering. So, Dr. Ankur, one more thing. We see a lot of backaches in developing countries, especially like India, as compared to the Western population when we see their population demographics. So, can you tell us something like what measures we can implement in India to have like proper back, healthy back regimes.
So you are saying that what can we grasp from the Western
Learn
world
from
and apply in India?
them actually, how they maintain their spinal well-being.
Sure. So I think now the world has become quite global, and we have a lot of information sharing and knowledge sharing with our Western counterparts, and even the population. And I think we can learn something from the West in terms of both in terms of medicine and also in terms of general lifestyle. So we know that in the Western countries the elderlies are much more active than an average Indian elderly. They keep on getting involved in sports. They do their activities on their own till very late, and it's not uncommon for them to be absolutely staying alone and taking care of everything for themselves till their 80s or even early 90s as well. And I think the reason being is that the Western world is probably a little more conscious about health, is a little more conscious about exercises, and they have been constantly working towards it. But I have to say that India is rising up to that. I can see that now a lot of young people and a lot of middle-aged or elderly people are also have got very conscious about their health, especially in the urban population as well. Marathons have caught up in India like anything. You can see more and more cycling groups which are going out, and people are much more aware about these things. So I think India has taken a right step towards general health as well as spinal health. At the same time, there are certain screening programs which are done by the medical health system of West. They have regular bone density checkups every 3 years or 2 years in their population, which is not something which has been really adopted in India. And we tend to get these bone densities checked only as per requirement basis. Only when a patient gets a fracture, that is the time when we are trying to look at a DEXA. And usually we would in our own discharge summaries, when we discharge our patients after a femur fracture or an osteoporotic fracture, we tend to miss out on these osteoporotic drugs which are to be given. So I think we as clinicians and physicians, we need to be more conscious about the existence of osteoporosis, and importance of a better nutrition, which is something which we can get. At the same time, I think India has also learned a lot from the West. We have started adopting a few things, like vitamin D used to be really deficient in Indian population, and one of the major reasons was that our milk was not fortified with vitamins. But I think in the last 5 years, the government of India has come up with orders to the milk companies to fortify vitamin D and vitamin A in the milk, and they've started doing that. So India is taking a lot of positive steps, I think, towards general health and spine health. But there's always a scope of improvement, and I think more community awareness programs about spinal health, general health, webinars like this, like we have got together today, I think all this will take us a long way in making India more healthy.
Yeah. Sure. This kind of webinar, like panelists like eminent spine surgeon as well as eminent joint replacement surgeons were there to give insight. So this gives us like pleasure to conclude our session, and I would like to thank all panelists. Khushbu, can you conclude the session?
Before Khushbu takes over, I would like to thank Dr. Ram Kinkar Jha to excellently moderate the session, involve all of us, ask the right questions, and get us to answer the right answers probably, and spread information. So I congratulate you, Dr. Jha, for excellent moderation.
Thank you all. So we can leave this session. Thank you all.
Thank you, everybody.